current research and how that relates to our ongoing conversation about the impact of COVID-19, both on our academic life, but also more broadly, I suppose, as individuals interacting socially and politically, and how can we understand what's happening with us in the wider context. So I'll only have 20 minutes, but that is probably not enough for this topic, but it is in a way enough for me to just share with you some of my thoughts and how I see this topic. Now, as those of you who are following what's happening in this country and abroad, you would have come across recurrently, and unfortunately, of course, recurrently, you'll come across racist stereotypes about the Roma and about travelers, as we call them in this country and in Ireland. And these, racist stereotypes abound in the media, both, as I said, in the UK and in Europe. And to me, this is a clear indication how the long history of social and economic and cultural and political marginalization of this population, of this community or communities, is perpetuated. Now, what I could see since February onwards, when I started looking into this issue, is that COVID-19, in a way, repurposed long-established racial and eugenic stereotypes about the Roma. And these are the two directions I want to explore briefly today. On the one hand, racism, and I can see that expressed through stigmatization and demonization, of the Roma. And on the other hand, eugenics, and how this is expressed through the medicalization of their social and reproductive life. So I can see these two very interesting traditions in European societal behavior, and British and American as well, but my main focus will be on Europe today. How they intersect, how they impact the Roma, and how in a way they reveal some very deep-seated stereotypes and prejudices we have about these people and how they are perceived by others. Now, some of you may remember a controversial Channel 4 documentary, Dispatches, The Truth About Travelers. And I use the word truth here, lightly, because obviously that was the purpose of the documentary, which was aired in April. And this documentary, of course, caused a great deal of negative reactions from the Roma communities themselves and the traveler communities. They received a lot of complaints because they portrayed the travelers in a very negative way. But most importantly to our conversation here and to what I try to say, it fed into, if you want, into the widespread perception people have about the Roma as criminals. So there is something innately criminal about the Roma and about the travelers. So that will be your first reaction if you see a Roma person on the street, would be either to protect yourself, protect your pocket, or instinctually you'll behave in a way that suggests that this idea of the Roma person, being a thief or being a petty criminal or being a serious criminal, it's very widespread. And this documentary didn't try to explain that, didn't try to exfoliate that argument properly, but rather play into that kind of thing. So that was very problematic. But in a way, it illustrates how, in a way, people think about it at various levels, common people, but also politicians and people in the media. And then more recently, again, you may not know this, but our Home Secretary, Priti Patel, was interviewed or asked to, there was a big discussion with the British Jewish leaders in September, and she was asked to participate. And then the conversation digressed a bit, and then she again said something about the Roma and the travelers and their criminality. In effect, basically failing to point out that it is individuals, not communities, which commit crime. So you don't look at the Roma as an individual. We talk about the Roma, but we see the group. When we talk about white people, I say, I see Paul, I see Vivian, I see Gary. When I talk about the Roma, I don't see individuals, I see a group. And that, people fail repeatedly to recognize individuals within that group. We just see the group. And then we accordingly create a mythology about that group, which has very serious impact socially and culturally and politically. And now with the COVID, we could see how that in Europe really re-accentuated all deep-seated prejudices against the Roma. Now, we all know racism thrives on anxiety. It feeds off insecurity. And the current COVID pandemic, of course, has provoked many anxieties at all levels. And these anxieties, in a way, add to the already pernicious vortex, if you wish, of xenophobia and nationalism, which dominate our political life. So if our political life wasn't bad enough before COVID, it got even worse, both here and in America, as we've seen with Donald Trump and the elections, which only is to brought to the surface things we always, well, we assume they're long gone. In some cases, we knew they're still there, but we believe they are controllable regarding the human psyche, the human prejudice, racism, and the way we perceive the other, the foreigner, the immigrant, and so on and so forth. And so COVID, in a way, and the discussion about what's happening with us at the moment, in some particular instances and in some particular countries, really brought to the surface some very nasty and some very ugly subterranean feelings that actually the population do share. So this is one of the things that academics, in a way, were very surprised to find out how much the common people are actually prejudiced, racist, both against ethnic minorities, but also, against other minorities, against disabled people, against older people. So we could see these debates happening across the board, whether it is an ethnic group or maybe a sexual group, or maybe, it is a person with disability. So you have an intense debate now on certain things that we thought are through education and through a repeated attempts to teach tolerance. These things are gone, but actually they aren't gone. So what I did, I looked at the newspapers and the political debates in a number of European countries since February onwards, and even a cursory look at the European newsletters. So I looked at countries like Greece, Bulgaria, Romania, Hungary, Slovakia, Czech Republic, Poland, countries with significant Roma population. So what happened, what I realized that, since February onwards, March onwards, if you will, racist dynamics have resurfaced in these countries. They've been reintroduced into societies, and they are normalized again. And the continued denigration of the Roma and the consolidation of anti-Roma racism is one of the outcomes. But at the same time, it may be a surprise to us here, but at the same time, those of us who know the history of Europe, these episodes only illustrate in many ways the long-lasting impact of racism in these countries. So this is not something that happened overnight. It may have reached certain intensities during COVID-19, but what COVID-19 did, in a way, brought together all these, disparate and loose ends of current racism that have a long history in Europe, and that has to be unpacked and has to be put and has to be challenged, has to be put to discussion, both by academics, but also by people who are involved with social activism and fight anti-Roma racism in their respective countries. Now, I would argue the Roma are victims of COVID-19 and they are victims of racism. It has to be stated explicitly. They are constantly abused and mistreated by the police in countries such as Romania or Bulgaria or Hungary. They are often decoupled from society. So when you speak about the Roma in Hungary, you speak as if there is another country that belongs to the Roma, or another nation that belongs to Roma and another ethnic group, and so on and so forth. So they are immediately decoupled consciously and unconsciously by the speaker. So you could see that it's across the board. They're decoupled from society and they're decoupled from the body of the nation, as if they're no members of that particular society. So that's immediately very striking. Secondly, they dehumanized immediately through various allegories And I mentioned one, which is their innate criminality. So there is a long conversation in all these countries. We could see it here to some extent as well about the Roma being, the criminal interface, and the Roma are those the purveyors of criminality in this country. So they immediately attach that. Then you have, of course, the social arguments about their poverty, about their loose morals. In other words, about their inferiority and backwardness. The Romas are different. They're outcasts. They're outside. But this is done in a way to explain why the state violence against them is legitimate. The majority of the population doesn't really revolt when they hear yet another example of police abuse against the Roma. So most of the people, of course, there are always exceptions. Of course, you have people in these countries fighting this who are not Roma, but the majority of the population would really agree with the intervention of the police. In other words, the strong arm of the state trying to control the Roma communities in their respective areas. They will just believe it is legitimate to deal with these people in this way. And that's a serious problem, both philosophically and conceptually, for people trying to understand how racism works in society and how certain group of people are very happy to condone, although explicitly they will never accept they are racist, they will never accept they are racist against the Roma, but they will condone state violence against them as being seen as the only possibility to manage this population, to bring them into the fold, to assimilate them, to integrate them. And of course, we know that this had happened before. And that's the thing about the conversation in the European context. So two things I want to say about it very briefly, so I don't want to run out of time completely. One is about, as any historian of medicine will tell you, one is about the relation between pandemics and race or racism. So in modern times, of course, pandemics has been racialized. So what do we talk about? The smallpox epidemics at the end of the 19th century in America. If we look at San Francisco, it struck twice or three times, I think. And that in the end led to the Chinese Exclusion Act, as we know. So you have a serious attempt to associate certain outbreaks with particular ethnic groups. So we could see that racialization of pandemics, it happens. We could also look at Europe, if we look after the First World War, closer to home, and the typhus epidemics, and how sort of German experts, and then of course other experts from across Eastern to Europe looked at typhus, for example, and then connected that with anti-Semitism and with anti-Roma racism, because of course the Jews and the Romas were seen as parasites, as people who were spreading the typhus. So you have that, and you could see this with COVID as well when it started. When it started, we could see this in America. Of course, there was a big conversation, and it's still going on with Donald Trump, calling the coronavirus the Chinese virus, and of course assuming that there's something that was concocted by the Chinese, and then so you have this very anti-Asian American, anti-Chinese rhetoric embedded in at least in the initial conversation about the virus. But this happened across the board. It happened in other countries. If you look at countries like Mexico, for example, they have a very important conversation about what is the Mexican nation there, and the very profound anti-Chinese sentiments expressed through the COVID from this point of view. Of course, what you have here, you have certain cultural norms and certain culinary tradition being racialized and eugenicized. So you hear very prominent public figures in Mexico talking about the Chinese eating their kitties and doggies, and this is what happened. They eat forbidden food, they eat, all these sort of things, and that led to. So it's a gross and crude description of a particular cultural norm, then it's racialized immediately. We could see this in Africa as well, or again in countries like Nigeria. We heard this last week in a presentation given by one of my colleagues at Oxford Brookes. People, associating the virus with the Chinese and anti-Chinese sentiments. So, you have these cultural traditions being pathologized. and then being used, of course, to explain that we are victims, and then we are assaulted by these external factors. Interestingly, it didn't happen in other parts of East Central Europe where you have strong Chinese communities. I mean, in Hungary, for example, you have a very big Chinese community in Budapest, and I did not come across anything anti-Chinese relating to the virus. So everything that I heard that was sort of racial and pathological and eugenic was basically against the Roma, not the Chinese. So it's interesting that they didn't build that into it. Okay, but let's move back to Europe. What I do in my research, I situate the repurposing of the old anti-Roma racism at the interstices between current public health and sort of European biopolitics. So I can see that Roma continue to be considered innately primitive. They are considered to be dirty, unhygienic. They are still described as a social problem. And you can see this across the board. I have numerous examples. I can give you one of them. It comes from the mayor of Košice. You may have seen this one in Slovakia. He said, well, it's impossible to do anything with the Roma because they are socially inadaptable. So they cannot be brought into any social contract. That's one of the oldest eugenic arguments developed in East Central Europe about the Roma. They wouldn't use the word race or racism. They will say, well, socially, they are a problem. And they eugenicize the entire argument about the Roma in this way by avoiding explicitly any reference to race. Because, of course, they will say the Roma are not a race. So you can see that happening. But this, as many of you know, in East Central Europe has a long history which is still unknown to the majority of the population, regrettably. So there is a long history of pathologizing the Roma, and they were targeted both by racial scientists and by eugenic policies in the past. If you look at the interwar eugenic literature on the Roma, they are described as human parasites, and then you have public health experts building public health infrastructures in these countries. And then, of course, they always attack the Roma for being the virus trying to undermine the host, trying to undermine the majority of the population. And this was a widespread narrative in the interwar period across Europe, particularly in East Central Europe. And then, of course, as you know, it reached the pinnacle in Nazi Germany under the Holocaust, where the Roma were exterminated in concentration camps. And this was long time in the making. Their dehumanization, their description as parasites, insects, vermin that has to be exterminated. So there's nothing you could do. All attempts are futile to assimilate and to integrate them. And it's really, really shocking and strange in many ways to hear someone in 2020 speaking almost with the same words and referring to the same things after what happened 70, 80 years ago. But it does happen. So coronavirus pandemic intensified the anti-Roma sentiments in Europe, and in particular in East Central Europe. And in many ways, what it accentuated was this impression that the Roma are the carriers of the virus. Now, this has to be explained in a way. So on the one hand, you could see the eugenic experts of the past are now replaced by the COVID experts of the present. And they still need to police the area. They need to identify immediately where the Roma are and separate them. So you can see all of these eugenic tropes returning when the Roma are discussed and dealt with. The areas where they live, they are described as nests of contagion. And of course, I want to stress the point here because it's important. Roma are not, even if we look at just East Central Europe, the Roma are not sort of a homogeneous group, and they're not monocultural. So there are many differences amongst the Roma, but there are two very important sort of subheadings, if you wish, or differences that then as now have relevance. One is about the sedentary Roma, and the other one is about the nomadic Roma. So a lot of the racist, the eugenic rhetoric you hear in the 1920s and 30s, and you hear it again in 2020 during the COVID-19, was basically about the nomadic Roma. The sedentary Roma are a major problem, and you have this situation in many cities across East Central Europe. You have this particularly in one city in Transylvania, in Cluj, where you have a very big sedentary Roma community on the outskirts of the city. And they are constantly under a barrage, an avalanche of racist language, but also racist policies orchestrated by the Romanian municipality or the city hall of that particular city. So that's one thing, and they would crop up, but it is assumed anyway that these are the people that can be to some extent assimilated, integrated. However, the nomadic Roma cannot be assimilated. The nomadic Roma, by the mere fact they are, transnational, global, they represent in a way the ultimate fear of any biopolitical project in East Central Europe. They are the difference par excellence. They are the people who could not be easily corralled and brought into the fold. And of course, as we know, nation states function because they want to create homogeneous subjects. If you have homogeneous subjects, you can control it. And any sign of difference is problematic. How do they deal with people who are different religiously, or they have a different color, different tradition, or they have a disability, or they have a different sexual preference? It is a problem for the modern state because they have to accept the difference can be as important as homogeneity, and that's a problem. We know that way back, but the nomadic Roma always posed this problem. Now, in the interwar period and during the Nazis, the way that they tried to deal with it was, of course, to capture all of them and then send them to concentration camps. And not only the Nazis did that, the Romanians did the same thing. The Croats did the same thing. The Baltic states did the same thing. Even in countries where you don't have too many Romas, like in Denmark, they still, or Sweden, still very important discussion in the interwar period from the racial and eugenic point of view about the Roma and the danger they represent to the majority of the population. Those who are nomadic are always moving across, and they carry with them all sorts of diseases. So from the point of view of a modern biomedical and public health perspective, you cannot control that because these people will never stay in one place. From the point of view of eugenics, if they try to assimilate, then we have another problem with that because, okay, they will just undermine it and sort of weaken the racial qualities of our population because these are, inferior people. I said at the beginning, regrettably, this is, on the one hand, a big topic, on the other hand, a very serious topic, and I don't want to trivialize the topic by simplifying or by pretending that there are easy solutions to this very serious issue. So that's from the point of view, from my point of view, I think what I wanted to highlight is, in addition to classical racism, which a lot of people look into, I think what is more difficult to observe and nuance is how a number of eugenic arguments survived in this conversation. And this is, in a way, a perspective I can offer as a scholar of the history of eugenics, because, of course, in that part of the world, the idea that the Roma are different and outsiders is woven into the fabric of everyday racism against them. But at the same time, while the population and people in the media and politicians too, they reproduce many eugenic arguments. They were very popular in the 1930s and 40s without them realizing actually that this is a eugenic argument, because there's no coming to terms with the eugenic history in this country or in that country. So that's really a problem. So what you can see, and I will finish with this, there are two things I can, by way of conclusion. One is that the Roma are constantly and strategically still kept on the margins of society, on the margins of the body of the nation. On the one hand, as I was trying to suggest, you have ongoing racialization of them in the pandemic context, which leads to the biomedicalization of their nature and customs and social existence. So everything is being trivialized and interpreted as a danger. So the fact that the Roma want to live outside and they live in nature, or they have a big family they have high fertility. All of these things are being reinterpreted to suggest that they are a problem and they represent a threat. So the hygienic norms of health protection have become eugenic norms of controlling this population. Secondly, if you look at how the conversation is happening in Europe, the interwar period and the socialist period in Central Europe is being reinvented as much as nostalgically remembered. So a lot of the conversation and a lot of the ideas people have about the Roma, actually, they are not from the interwar period. They are born under communism, and they are born of the socialist period. And that's the whole conversation about them being asocial, being idle, not wanting to work, not fitting, and so on and so forth. And that's something that needs to be said. Finally, I think what the current pandemic revealed and teaches us is that we should not neglect all these fictions about race. And I assume that because obviously we know that race as a category, it's not real, but people believe it is real. So all these fictions people have about certain ethnic groups are very powerful, and they still continue to dominate our society and still continue to dominate our system and the world we live in. So this polysemic nature of racism, if you wish, challenges us. It's not easy to understand anti-Roma racism. It's very tentacular, and there are many ways to approach it. So there's no simple explanation. It's not based on a simple dichotomy, black versus white. It's more complicated than that. So that means we need to become more active and more forward-looking and more provocative with our thinking, our research in this way. And we must, in every organized, I suppose, social and cultural and teaching way, both personally and collectively, make an effort to neutralize the multi-directional possibilities of racism. And the Roma situation and the Roma example is one of that moment where we need to come together and be active and challenge a widespread racism towards them.